Health Watch is presented by UMass Memorial Healthcare. Here, caring for you.
Welcome to Health Watch, presented by UMass Memorial Healthcare. I'm Chandler Walsh. Today, we'll give you tips to how to quit a vaping addiction. People who are trying to quit smoking cigarettes are turning to vaping. Is this a good alternative?
I've heard a lot of people say that, and I think it's wonderful that people are trying to find ways of quitting smoking. People thought that it might be a safe alternative, but what we're finding out now is that it's really not. And fortunately, there are a lot of other safer, healthier ways to quit smoking.
What makes vaping addictive?
A lot of the products have either nicotine or THC in them. Both of these products are addictive. People think that you can't get addicted to marijuana and THC, but actually about 10% of people that smoke marijuana do become physically dependent on it. And so in addition to that, there's also the behavioral cues of holding something in your hand or using something to cope with stress or just working it into your daily routine, and these kinds of behavioral patterns can become reinforcing as well.
How harmful is vaping?
Definitely more harmful than we thought it was. I've had patients say to me, well, it's just water vapor. It's not just water vapor. There are chemicals that are put in there. There are flavorings. If something is cherry flavored, they're not putting actual cherries in it. They're putting in a chemical that tastes like cherries. And so we don't really know much about these chemicals, and so it's really hard to say definitively how safe or unsafe something is because we just don't know enough about it.
What alternatives are there for people who want to quit cigarettes or vaping?
Well, there are a lot of medications that are available if people are using tobacco or a nicotine product in their vaping. So there's varenicline, which people know of as Chantix, and it's something that you take as you're still either vaping or using tobacco, and then after about a week you find that you just don't enjoy smoking or vaping as much. There's bupropion, which is also sold as Wellbutrin or Zyban, and that's an antidepressant that makes people want to smoke less. And then you can also use the nicotine replacement products if you're trying to quit either tobacco or vaping nicotine. So things like the patch, the gum, the lozenge, or a combination of these. And I always encourage people to not just rely on the medications, but to use psychosocial resources as well. There's a great resource for people in Massachusetts called My Quit Works. And for people that are under the age of 18, there's a website, My Life, My Quit. And you can go on there, you can connect with a recovery coach, you can get information about quitting, you can get information about the risks of vaping, and so I encourage people to seek out these resources.
How can parents help their kids break an addiction?
I think it's important for parents to talk to their kids about vaping being something that's potentially dangerous. I've unfortunately seen a lot of adolescents that have never smoked a cigarette in their life, and they're dependent on nicotine because they got exposed to it through vaping. Because again, people think that it's safe. They don't think that there's any harm with it. And it's important for parents to tell their teens that it's not safe.